Hi, Miss Habercock. My name's Kellen. I'm going to be your nurse today. You doing all right?
Hi, Kellen. I am. I'm doing well. Thank you.
How's baby doing?
Baby is good.
How are you doing? How's your pain right now? Scale of 0 to 10, 0 being none, 10 being the worst you ever felt. Where are you at about right now?
I would say a 1.
Out of 1? Perfect. That's what we want. So I'm going to go over a little bit of discharge teaching with you, all right? Just before we go home.
Okay.
So first thing I want to start with, you don't mind if I take a seat, do you?
No, please.
So first thing I want to go over with is a little bit of bleeding. So right now you probably see it already. You're having some heavy flow. It's going to be red, dark red. You're going to have a lot of clots over the next 4 days, okay? After about 4-ish days, it should sort of change to a more pinkish brown color. You have some less clots, and you're going to have a lot less flow. After around 10 or so days, the clot should be completely gone. Should be almost no blood at all. And the discharge, you should be seeing more whitish yellow. Is that all making sense right now?
Yes.
Okay. Now something you do want to be aware of is postpartum hemorrhage. Are you aware of that?
I am.
Got it. I just want to go over with you for a little bit. So that can occur for up to almost 3 months after birth, okay? And some warning signs I want you to be aware of is nausea, vomiting, really heavy flow, like a trickle of bright red blood, okay?
Okay.
That doesn't slow or stop. Some other signs you might see is like soaking 1 or more pad per hour with bright red blood or dark red blood. Chills, becoming pale, feeling faint, and increased heart rate, and passing any clots larger than the egg, okay?
Larger than an egg?
Larger than an egg.
Okay.
You see any of those? I want you to call your doctor, okay?
Okay.
And I'm going to have some pericare with you. Because you had an episiotomy, it's all going to kind of cover the same thing. So, I want you to remember this front to back. Cleaning, putting on old pad, taking off old pads, putting on new pads, front to back process. When you clean front to back with warm water after each void. When you're drying, we don't want you to wipe, I want you to blotch, pat dry.
Do I get one of those squirt bottles to take home?
Douching? No, we don't want you to douche right now.
No, the little water bottles that you can squirt warm water. I had one of those on my last baby.
Oh yeah, we can give you one of those. We'll send you home with one of those. Do you know what a silk bath is?
I do.
You do? Well, you can do one at home as well. You don't have to have the fancy apparatus. You can just sit in like a tub of water that's about 2 to 3 inches, okay?
Okay. Can I put anything in it?
Preferably not.
Okay.
Preferably not. We just want you to use plain water. And also kind of going over a little bit of pain as well, just because you had that episiotomy and you had that baby too. Some at-home remedies, like I said, the silk bath, ice packs, ice can help the swelling, decrease swelling can help decrease the pain. Some more stuff on the medical side, stuff like Tux, native witch hazel, that'll help decrease your pain, swelling, ibuprofen. The big thing though with ibuprofen is we want you to take no more than 3,200 milligrams a day, okay?
Okay.
So no more than 3,200 milligrams a day.
Are you going to send me home with ibuprofen, or is it over the counter?
Over the counter would be fine.
Okay.
But it'll all be in here too, on the dosage levels as well. We can also give you something called Dermoplast topical. That and the Tux are more topical for pain, whereas like you said, the ibuprofen is something you take orally.
Okay.
And all those should help you decrease swelling and by extension decrease the pain that you have going on right now. Speaking of which, going back to the pericare, I want you to be sure to remember to use your trying to lift anything kind of heavier than the baby, and try to limit your stair usage, alright? I want you to rest as much as possible. We also want you to be aware of the signs and symptoms of infection. One me and you always have, everyone thinks of, fever. Anything above 100.4 is considered a fever. We want you to get that looked at by your doctor, okay?
Okay.
More locally, regionally, increase as in pain, swelling, redness, temperature, and purulent drainage or pus-like drainage. So something you see would come out of a zit, white generally, okay?
Okay.
I want you to be aware of that.
Okay.
I know, it's always, you always get that reaction when talking about purulent drainage. We've kind of gone over the medications. Activity, like you said, nothing really strenuous for the next couple of weeks. Same for driving. Want you not be driving for about 2-ish weeks after birth, okay?
Okay.
Stuff like you can do stuff for like your pelvic muscles, just that baby, they may be a little weaker. Want you some Kegels. How you can do those is kind of like when you pee and you stop peeing, that same sensation. Once you do that, hold that for about 3 to 5 seconds, relax, and kind of repeat that about 10 times for 3 times a day, okay?
Okay.
That can help kind of restore continence and just kind of help get everything healed back together. Kind of what I went over your episiotomy care, hand hygiene's a big thing for you and baby, helps prevent infection before and after everything. That's gonna be, like I said, it's 20 seconds, front, back, fingers, thumbs, you always miss it, your wrists.
Okay.
And like I said, Remember those signs, symptoms of infection, the temperature, the increased redness, swelling, pain, pus-like drainage, okay?
Should I be washing my hands before and after I go to the restroom?
Yes, before and after.
Okay.
Before and after. We're also going to talk a little bit about your postpartum depression risks. So, like I said, just had a baby, hormones can get all kinds out of whack, right? So something called postpartum blues is very common, very mild symptoms, generally goes away after about 2-ish weeks. For postpartum depression, symptoms are going to be a lot more severe and then be a lot more persistent, be lasting a lot longer, okay? What you want to kind of look out for is sort of increased irritability, lack of interest in the baby and the baby's care, appetite, sleep disturbances, crying, sadness, loss of joy, kind of feelings of shame, and thoughts of harming yourself and or the baby, okay?
Okay.
And if you're feeling any of those, again, call your healthcare provider, all right? We'll kind of go over the call your healthcare provider issues and calling 911 issues a little later on, okay? So, doctor checkups. That's part. You'll go to your OBGYN in about 3 weeks, okay? We'll talk about when baby's going to go do their well checkups here in a little bit, all right? And speaking of baby, that's part. Feeding. Babies are hungry. Babies got to eat. Babies got to eat. They're going to eat about 8 to 12 times a day, okay? You kind of want them to eat for as long as they want. You don't want to keep them on, and then after like so much time, oh, you're done, they'll tell you when they're done, okay? To kind of help you with some of that engorgement, some of that discomfort, breastfeeding larger with milk is going to be, you're going to want to maybe take a warm shower beforehand, apply a compress that can kind of help stimulate the milk let down and kind of help with some of that swelling, okay? I'm trying to keep them skin to skin. You are going to be breastfeeding, or you can do bottle feeding.
Well, we'll try breastfeeding, but for me, it's not a big deal. So,
Okay.
We may do bottle feeding as well.
Bottle feeding as well, okay. Same rules apply for bottle feeding. You're going to want to maybe be a little more cautious of kind of how much you're giving the baby. Right now, it's really small. It's probably about the size of my thumb. Hold maybe 10, 15 mLs. As it goes a little bigger, baby grows a little bit more after a couple months, it should be able to hold closer to about 60 mLs of fluid. You just don't want to give them too much, okay?
I think usually I start them at maybe 2 ounces a time.
2 ounces at a time? That's about 1 ounce for right now.
Okay.
Just because their stomach. So it's 1 ounce, they get a little bigger, increasing that. Some benefits of breastfeeding obviously helps keep a baby's immunity, helps kind of decrease the risk of them developing obesity, diabetes, also helps decrease your risk of breast cancer, okay? So lots of benefits. Help keep you the baby calm. It can also help prevent jaundice in your baby, which we'll go over here in a little bit. Kind of some symptoms, or I guess what to look for your baby. Crying is kind of like the last stage of baby. I'm hungry now. Something to look for maybe before all that is rooting. Baby's going to kind of nestle up to you a little bit more, kind of sucking on their thumb, finger, maybe sticking their tongue out, maybe moving their arms a little bit, and then if they're really hungry, they're going to start crying and let you know they're hungry. Any questions so far?
No.
Okay. So I'm going to talk about output as well. What goes in has to come out. You're going to have about 4 or more loose stools a day. They're going to be kind of like light yellow color. And you should be having as well, with those as well, you should have about 6 or so wet diapers a day. Clear. They should be clear or light yellow.
Okay.
Anything that's kind of dark can kind of mean that you might be a little dehydrated. Okay.
Can I give him water?
No water. Just want him to breastfeed.
Just kidding. I wanted to see if you knew that.
Yeah. No water. Everything baby needs, baby's going to get from its milk, from its mama, or its formula. And if you do formula, you have to mix it as specified, because they can cause malnutrition or overhydration of baby. For yourself, when you're breastfeeding, make sure you get plenty of fluids, plenty of protein, fats. Okay. We're going to talk about stump care for your baby. Pretty straightforward. Keep it clean, keep it dry. When you have your diaper, make sure you fold it down. Make sure there's nothing tight on the baby's abdomen, and don't pick it off, please. It'll fall off on its own in a couple of weeks. Yeah, you always go over that, people. For bathing, and skincare, like I said, be aware of jaundice, and we'll kind of go over that right now. So what jaundice is a buildup of what's called bilirubin in baby's skin. It is common, and something you can do at home to prevent that is making sure you're feeding them properly and giving them enough to eat, okay? what you kind of see, look out for is, really, really sounds like white or yellowing of their eyes. Maybe not having enough stools per day. That's kind of how they get rid of the bilirubin. Poop it out. So, not eating a lot, maybe not pooping a lot, not peeing a lot, maybe being a little lethargic, not eating as much, sleeping a whole lot, anything that kind of decrease their intake can kind of increase the risk of jaundice.
Okay.
And if it does get serious, you just bring the baby in. They'll put them under a light. The light will help get rid of jaundice for them. Okay.
Okay.
And they're gonna check you. They checked the bilirubin levels here already. They were fine. They will check them again at your well baby checkups. Okay. Let you know if there's anything you need to be concerned about.
Okay.
Like I said, kind of going back to diaper care, like I said, fold it down around the umbilical cord. Prevent diaper rash. Big thing is just change your diapers when they need to be changed. Don't let them sit in a wet diaper. You do clean them. Baby's got rolls. Make sure you're getting in those rolls, cleaning and drying them. A lot of people clean, maybe don't dry them the best. Stuff like baby powder can kind of help prevent moisture buildup. But you need like actual lotions and all that stuff. You need to get your doctor to prescribe you those. You just don't want to use you don't want to use as much as you need to. For actually, cleaning your baby, giving them a bath. Like I said, hand hygiene before and after, giving them a bath. Kind of what you want to do to start that out with is make sure you get a couple towels, mild soap, and a diaper within reach. Obviously, once your baby's done, you're going to come back in the diaper. So, you only need to bathe them about 3 times a week, generally, or unless they get really dirty.
Big blowout.
Big blowout. We had a lot of those where I used to work. And for the actual process of cleaning, get them a nice warm room with the whole room be pretty warm. Water, you don't want the water too hot, but nice and warm, about 100 degrees. If you have an at-home like little thermometer you can use to check the water.
Yep.
Perfect. Love to see that. You just want to do a little sponge bath on them for the first few weeks. Starting head to toe. Remember cleaning in those folds, arms, necks, everywhere down there, hair area. Make sure you're cleaning and drying them. Okay. Any questions so far?
No.
Okay. Now we're gonna get into some of the safety stuff. So, shaking babies is not okay. We don't want you to shake your baby. It is a concern, it is an issue, and it can occur, even just a little bit can cause a lot of damage, So if you are, for whatever reason, baby's needs are met, they've been fed, they've been cleaned, they won't stop crying, what we want you to do is, instead of shake the baby, take some deep breaths, put them in their crib, and maybe leave the room for about 10 to 15 minutes and kind of come back, okay? If you really need to, you can call up some family who can kind of help you take care of the baby, give you a little bit of a break from them, okay? Same thing, kind of going over some safe sleep practices and SIDS. You know what SIDS is? Sudden infant death syndrome. Yeah. So it's anything that can kind of unexpected death of an infant under 1. Some things you can do to kind of prevent that is, give them plenty of tummy time. Babies love tummy time. Letting them breastfeed for as long as possible. Getting them their health checkups, obviously. Avoid overheating, which, no hats inside. If you go outside, put a hat on. But if you're inside, nice, temperature regular place, no hats. Making sure they sleep on their back, offering them a pacifier when they sleep. And neither you or anyone around you should be smoking around the baby, okay? Secondhand smoke is a killer of babies. Kind of going back to that whole prevent overheating and temperature stuff. Right now, your baby is going to be for the next about 27 days. Your baby's only about a day old right now. Up until about 28 days, baby's normal temperature should be around 97.7 to 100.4. After about 28 days, it should be normal range is around 96.8 to 100.4. Okay. So they're going to be running a little warmer, but then after about a month or so, they'll kind of go back to where we all normally live at. We'll kind of go over temperature changes and how that kind of relates to maybe baby signs, symptoms of that they may be sick, they may have an infection. And how to check their temperature is pretty simple. You can do it, we don't want you doing orally, nothing in the mouth, armpit, or if you really need to, in their butt, rectally. Rectally is the more accurate of the two, but babies don't really like that.
Right.
So axillarily, you just take the silver tip of the actual probe, slide it right in their arm, hold their arm against their body, and just wait for it to beep for you, okay?
What about the ones that you scan their foreheads?
Those aren't as accurate, prefer that you do axillarily or rectally.
Okay.
kind of gone over your jaundice stuff already. One moment. The spiel, you know. Circumcision care. Is your baby getting any circumcision?
No.
No? Okay, well if you do decide, kind of care will depend on the doctor, but if you do ever get a circumcision or decide your baby's gonna get a circumcision, just keeping an eye on like it, you know, signs of infection, you know, redness, swelling, purulent drainage, whole shebang. Car seat safety. Baby should be facing backwards, it should not be facing forwards. If you need to, you can go to, there are locations that will like certified will install it for you. And if you haven't done it already, you should have had it installed before coming here. Baby, did you already get installed?
We did. We actually went to the fire department because they will install it safely for you.
Oh man, I love me some firefighters. I had a cousin who was a firefighter. Yeah, and no, also do not add anything aftermarket, you know. Whatever it came with is what you want to keep it with.
No nice speakers.
No nice speakers, no Bluetooth, no little hangy bits, no headrests.
No air freshener?
No air freshener.
On the handle carrier?
Nope, none of that. We've already gone infection control, you know, washing your hands before and after. I will actually just use this time to kind of describe, you know, like I said, what to look for in baby. So babies don't always want fevers, you know. The big thing with them is temperature instability. They can be really, if they have an infection, they could be hot. They must be cold, you know. Okay. That's why I want to be sure that, you know, because your baby is within that 28 days thing, if they're anything below 97.7, that should be something that you should be concerned about. Okay. Some other signs for baby, I said, fever, temp instabilities, crying. Maybe they're having like some like pebble-like stools, like maybe constipated, or like really liquidy wet stools, diarrhea, projectile vomiting, coughing, difficulty breathing, pale or blue skin, and we'll kind of go over again which ones are kind of what you really want to urgently call 911 about, and which ones are go to your healthcare professional about. Okay. Which for baby, any change in color, blue, white. Any serious difficulty breathing, that's going to be 911. You're going to want to call 911 about that, okay? You okay?
Oh, I'm fine, yeah.
Good. Any questions so far?
No, I don't think so.
Okay. We're going to talk a little about airway clearance, those bulb syringes. Everybody knows about them.
Yeah.
Big thing for your baby is going to kind of be coughing a little bit, sneezing a little bit. They're going to be using it to kind of clear their airway. Afterwards, it's common for baby to sneeze and not breathe for a second or two, you know? Okay. It is pretty common. It's a little late. Their respiratory rate is not the most regular sometimes. As long as they don't look distressed, they're not having any like difficulties breathing, and as long as they're not changing color, they should be fine, okay?
Okay.
But maybe they get a little cold, maybe get some secretions, you want to get those out. For the bulb syringe, you want to compress it, put it in, and then gently release. You don't want to just let it fling open. You want to kind of gently release it so it can suck everything out. You want to make sure you aren't using it too much because that can cause some irritation to the face. Sure. You're just poking the baby with it. And cleaning it is pretty simple. Just warm water, soap, you know, getting it in and out. Okay. I talk about your symptoms of infection. And we're going to go over some stuff that requires some immediate attention for you. Okay. So I want you to pay really close attention to this, all right? So for you, if you're having any chest pain, shortness of breath, breathing difficulties, seizures, and for seizures, sometimes you have some kind of aura, which is like a weird sight, smell, sound, feeling that you kind of perceive that, you know? So if you're feeling like something's not right, I'm feeling a little funky, you know, just kind of be aware of that. That could maybe be a prelude to a seizure, okay? Any thoughts of hurting yourself or the baby, and any hallucinations, you're seeing or hearing anything, any of those, call 911, okay? Okay. For stuff that's not as urgent, where you're going to need to call your healthcare provider, is kind of any sudden swelling of your hands, feet, or face. Okay. You have episiotomy, incision's just not healing for whatever reason. You're getting some redness, some swelling, some painfulness in your legs that are kind of warmed up at touch. You yourself having a temperature above 100.4 can mean maybe you have an infection. A headache does not go away, persists, and that is causing some sort of vision changes. And like I said, that kind of heavy vaginal bleeding of maybe greater than 1 pad per hour, okay? And for your baby, the big thing is any serious difficulties breathing, any changes in color, especially around their mouth. That's kind of when you first notice it. So like any blueness of like their face, tongue, lips, okay? Or if they start having a seizure, any tremors or seizures, okay? You're gonna want to call 911 for that as well, okay?
Absolutely.
That is in here on page 48 for you, okay?
Okay.
You even have it bookmarked for you.
Thank you.
I believe we've covered everything. Do you have any questions so far?
No, I think we're ready to go.
Okay. Well, ma'am, it's been a pleasure getting to work with you today. I'll get out your discharge orders in place, okay?
Thanks, Kellen.
Okay.